This is what the heart of somebody that will have a stroke sounds like. About 8 to 10 years ago, that's what my heart sounded like. That irregular heartbeat is caused by the number one hidden heart problem that causes strokes. It's called atrial fibrillation. Because I was fortunate enough to find out that I had it, I was able to control it. I avoided having a stroke. In this video, I'll show you how I did that and how you can do that as well, and the main ways to treat or manage or prevent atrial fibrillation. We'll discuss medications, yes, of course. We'll discuss surgical procedures, as usual. We'll discuss supplements as well. But most of all, we'll discuss lifestyle, because that's where the root cause is. My name is Dr. Ford Brewer. I'm a preventive medicine specialist with over 40 years of experience. So let's get started. What is atrial fibrillation? Well, this is your atria when they're not fibrillating. This is your atria when they're fibrillating. The most common heart arrhythmia, when it's coordinated, a coordinated beat like this, it fills the ventricles, the major chambers of the heart, and adds 20% more boost to what they're doing. When it's doing this, it doesn't help. In fact, it sits there and the blood pools, and that pooling blood can cause a clot. And that is a big problem, because clots have a high chance of being pumped outside of the heart. And if you follow the vessel's trail long enough, they can go directly to the brain. A clot that's big enough and goes to the brain causes a stroke. The most common type is called an ischemic stroke, or a clot-based stroke, in which you lose blood supply to that part of the brain. The other type, which is not very common but happens, is called a bleeding type of stroke. So there's the clot stroke or the bleeding stroke. When the clot blocks the blood flow, a part of the brain dies, resulting in things like slurred speech, limb paralysis, disability. 2/3 of strokes are ischemic or clot type of strokes, in which there's blood loss to the area of the brain. 25% of strokes are what we call cryptogenic. Now, what does that mean? Crypto just means we don't know where it came from, and genic means where it came from. So we don't know where cryptogenic strokes came from. At least that was what the case was up until a decade or so ago. Now what's happened is this. New research is showing that 2/3 of those, quote, we don't know where it came from, cryptogenic, unknown cause strokes, are actually the result of the number one neglected problem, heart rhythm. And guess which one? Atrial fibrillation. You might be thinking, okay, well, you got me. That's scary and it's a problem. But the crucial question is this: how do you know if you actually have it? Well, let's discuss some signs and symptoms that might suggest you have atrial fib, because a lot of people have it and don't know it. It's sort of like the thing with prediabetes. A lot of people have it and don't know it. Meanwhile, it's causing significant problem. For the people that do have symptoms, you'll find things like shortness of breath, palpitations. Again, palpitations are just a feeling of fluttering in your chest. You can feel some dizziness or even fainting sometimes because it decreases the output of the heart. Chest discomfort, other than just fluttering, just a dull, achy feeling. You can even have sudden strokes, or what we call mini strokes. The docs call them TIAs, transient ischemic attacks. So it's like an ischemic attack, like a stroke, an ischemic stroke, but it's only transient. It goes away within 24 hours. Now, these are all symptoms of atrial fibrillation. Here's the thing. You don't want to have these symptoms. You want to know about that long before. You need to have an understanding of your heart rhythm. That's one of the first steps. While an irregular pulse is highly indicative, it's very suggestive of this, your doctors will still require more tests to fully evaluate your condition. Doctors often use what's called an EKG, or electrocardiogram. The test is basically a 1 or 2 minute picture of your heart's electrical activity. If we see specific electrical activity in that EKG, we can make a precise diagnosis of atrial fib. Sounds simple enough. Why don't we just screen everybody with an EKG? Well, there's a couple of problems. First, you want to find this before you're having symptoms. And second, and most of all, if you don't have symptoms when the 1 minute EKG test is being performed, it may actually miss the problem. And therefore, we think we've screened for it, it's not there, and it actually is. See, there's a variant of atrial fib. It's called paroxysmal atrial fib. Paroxysmal type still increases your risk of stroke 5 to 8 times. The electrical activities may come and go, but that clot is still forming. EKGs have been proven to be ineffective at screening for this paroxysmal atrial fib, or the atrial fib that comes and goes. So what do? Well, there are alternatives. For example, a Holter monitor, portable machine that will work as an EKG, but will track your heart rhythm for about 24 hours and up to 28 days. That's almost a month. That sounds great, right? Why don't we use that? Well, there are a couple of problems with this as well. First, wearing it is very uncomfortable. I wore one for 2 weeks. You can't get a shower. You can't really get a bath. You just sort of have to wipe down because you're wearing these cords attached to your body and a big machine. The second problem, this type of testing can be expensive with or without insurance. So now there's good news here. Each year we get more and more access to newer, better devices. Take this Zio monitor, for example. It's gaining a lot of popularity with cardiologists and with patients for obvious reasons. It's much easier. This is not a sponsored video, by the way, not by Zio or iCardia or Apple Watch or any of the other devices that we're going to mention. Ultimately, despite the challenges, the Holter monitor is still probably the best way to find atrial fib. But what if a heart monitor is not an option for you? Some wearable devices can still provide valuable insight to these electrical disturbances within your heart. A recent study reports that Fitbit can have a predictive value of about 98% for atrial fibrillation. But let's be careful with this evidence, since Fitbit, the company, was involved in the funding of this research. In another study, comparisons were made with Apple, Samsung, Sense, and iCardia watches. The best detections of atrial fib came from Apple and Samsung watches. So there is clear evidence that wearables, especially those that include some artificial intelligence software, are becoming an excellent option for finding atrial fib. They may not be totally there yet, but they're coming a long way. They've come a long way fast. Especially asymptomatic people. That's the problem. Again, you have people that have paroxysmal, this come and go type of atrial fib, and then you have people that never have any symptoms at all. So let me tell you a little bit about my story. I knew I had risk because I had done some cardiogenetic testing early on that showed that I had 2 copies of the atrial fib gene. It's also called 4q25. I got one from mom, one from dad. Now, what does that gene do? It makes the muscles in the atria, the muscle fibers, evolve more quickly into conduction fibers. So you've got all of these new conduction pathways. If one of those conduction pathways connects back into a loop, you start getting that loop in the atria, and that's what causes atrial fib. So I knew I had some risk there. I also knew that I was an endurance athlete. I had run, countless half marathons. I did one of those per week, usually for training. I did half dozen marathons. I even ran an ultra marathon. The marathons, by the way, are 26.2 miles, and the ultra is 40. Weekly, I was doing 13 and a half miles, in addition to playing a couple of hours of hard full court basketball. So I had significant risks from a lot of endurance training. I had significant risks from genetics. And sure enough, I had noticed several times that I would get into these episodes of palpitations. I always wondered if these palpitations might actually be fibrillation. So I looked around for ways to detect this. The Apple Watch was not quite ready for prime time at that point, but you had a lot of devices even on Amazon. I got an iCardia device. It had a simple electrode. You put both thumbs on it. It connected to your iPhone, and it gave you what's called a rhythm strip. I could see the rhythm strip of my heart. For the most part, it looked fine until I woke up one night and knew I had it even before testing it. I had this thumping going on in my heart. My heart rate was about 160 beats per minute. It was irregular. The doctors talk about is an irregularly irregular, which I won't explain. Heartbeat is pretty clearly diagnostic for atrial fib. I put my thumbs on the electrode. I saw that I had no P wave, again, meaning my atria were just not connecting on a coordinated basis. Yep, I had it. The heart rate was about 160 per minute. I eventually came out of it, but I was also able to document it. I went to see a cardiologist and then a rhythm specialist, heart rhythm specialist, what's called an electrophysiologist. I got a Holter monitor, as I mentioned. I was I developed into atrial fib 20% of the time. You don't want to be in atrial fibrillation that often. You want to be a very small percentage, 5% or less. Either one causes risk for strokes, but when you're in it for longer periods of time, that rhythm that pathway that you're using, we call it an aberrant pathway, that unusual pathway that's taking you in circles, that goes on and is much more likely to remain unless you get out of it. So I was considering an ablation. We'll talk about those a little bit later in the video. But at the end of the day, I wanted to do it with lifestyle because ablation, like every other surgical procedure, has its own problems. And yes, we'll talk about those as well. I'll tell you a little bit more about my atrial fib story a little bit later. But let's talk about you right now. Let's say you've just found out that you have AFib, or maybe you already know you have it, or maybe one or both of your parents have it, and you're just wanting to know, do I have it? Even if you know somebody has atrial fib, that's really step one of the question. The question is, how much of an increase of risk of stroke do they have, or do you have? There are multiple ways of assessing that risk of stroke. The most used one now is an acronym, and it's called CHAD2 VASC2. I'm not going to go into the details of how to do that, so don't worry about that piece. But I am going to tell you the basics because those are very helpful at this stage of learning about this. As usual, it goes back to lifestyle and risk factors, age, gender, history of heart failure, blood pressure, stroke, TIA or that mini stroke, and vascular disease. All are very important in evaluating your risk of stroke from atrial fibrillation. But we need to take a look at one last and dangerous factor that contributes to strokes before we go any further. What is it? Diabetes. Yep, it's known. Diabetes is a risk factor not only for atrial fib, but for strokes. Diabetes and metabolic disease. Metabolic disease is prediabetes and diabetes. It's the only disease that causes more strokes than atrial fibrillation. Your doctor will have to assess whether you have this condition. Now, when I say that, I cringe because I know that 3/4 of doctors responsible for detecting metabolic disease in this country, the United States, talking about family practitioners, internists, cardiologists, 3/4 of them don't know how to diagnose metabolic disease. That is scary. And that's one of the biggest challenges we have in medicine today. That's what this channel is all about, helping you understand what you need to know, because you cannot depend on your doctor to diagnose your metabolic disease and therefore to help you treat it. Until now, you've seen how to detect atrial fib and how to evaluate risk of stroke from atrial fib and how to consider other major risk factors like diabetes. But the question still remains, how do you manage atrial fibrillation? Well, let's get started with the traditional approach, and it is still the most important first step: blood thinners. You want to protect your brain from a stroke while you're doing the other things to look at root cause of atrial fib. So we're going to have to take a few minutes and talk about blood thinners. Now, here are some options, starting with aspirin, other blood thinners like clopidogrel. Before you go further, let me make sure that you understand this. The evidence is clear. Neither aspirin nor clopidogrel decreases the risk of clots and strokes as well as the other types of medications. They're called NOACs, novel oral anticoagulants. And you're saying, oh no, another technical word, I'll never remember any of this. You'll remember it because most of you have heard of it. Here's a couple of examples: Xarelto and Eliquis. So, they're more effective, they're safer than the other old blood thinners like warfarin. Aspirin does decrease the risk of heart attacks, but it does not decrease the risk of strokes for people with atrial fib. Why is that the case? It may get into the fact that these are clots forming inside the atria, but it doesn't matter. Don't worry about figuring that out. So, when I found out that I had atrial fibrillation, the first thing I did was I said, okay, aspirin's not adequate anymore. I'm going to have to bite the bullet and take one of those two. I started with Eliquis. At this point, I'm on Xarelto, but again, those are pretty much the same. There are some differences, no doubt, but on practical purposes for what we're talking about, it's Eliquis and Xarelto, the NOACs. There are two problems with these blood thinners. The first is that many people deal with bleeding issues. Taking aspirin or NOACs would be adding further risk to bleeding issues. And you see that with GI bleeding, gastrointestinal bleeding like esophageal bleeding. Actually, there are three problems with these things. The first is that they add some bleeding risk. The second is they are very expensive. They're just not cheap like aspirin. And I hate it, but again, aspirin does not work for stroke prevention for atrial fib. So that's two of the problems. They're expensive, they increase bleeding. What's the third problem? Well, they are effective treatment for avoiding clots and strokes, but they don't solve the original root cause issue. You still have the atrial fib. That's the third problem. Now, if you ask a cardiologist, you probably know what their answer is going to be. Well, to solve the root problem, you need to have an ablation. Well, let's talk about it. What is an ablation? It's a procedure. The doctor takes a wire, puts it inside the artery, your femoral artery, in your groin, drives it up to the upper chambers of the heart, the atria. Once there, it burns or freezes certain areas of those atria. What's it doing? It's burning those extra pathways that are causing that circular pathway for your heart rhythm. The idea is that since there are areas of the atrium creating additional nerve impulses or causing that circular pathway, and that causes the additional contractions, it causes rhythm issues. Burning or freezing those extra pathways will allow the heart to go back to a normal rhythm. Now, ablation clearly has been shown to be better than trying to use a medication to return you to a proper heart rhythm, especially in people who have developed heart failure. So it is better. Ablation is better, but it still hasn't been shown to prevent long-term risk of strokes any more than anything else. So evidence even suggests that the recurrence of atrial fib in the first year was as high as 50%. So that's the bigger issue that I was concerned about. I was ready to take my risks. If I could get rid of the atrial fib, I was going to take my risk that would decrease my risk for stroke. But here was the big problem for me and for most of my patients. Look at the evidence on ablation. It doesn't last. As I said, and you may have missed it, some evidence indicates that the atrial fib is back as often as 50% in a year. So that's like a coin toss. You are basically just putting your chances of stroke up for a coin toss. There's other issues as well. Recovery from ablation can be very, very challenging. So what about the other option for treatment? It's called cardioversion. It's where they shock your heart, like they do on the TV shows with the defibrillator, except they do this in a controlled environment. They take you to the operating room. They sedate you, and they give you a shock that'll restart the heart, trying to get a normal heart rhythm. It can have a success rate of over 90%. But that sounds like, let's just do that. Well, think about it. It also doesn't last forever. In fact, many people have tried it and found it came back within a matter of months. And you might think, well, it's risk-free, so we can try it again. Anytime you put someone, especially older people, under sedation, that's not risk-free. Here's the other thing. When you shock a patient and restart the rhythm, and you already have clots in the atria, so basically what you're doing is putting those clots into circulation. Restarting a normal rhythm can actually pump those clots and cause an embolus to the lungs or even cause that stroke. So the risk is the highest 7 days after the cardioversion is performed. That's why it's important to start blood thinners and antiarrhythmic medications as well to decrease these risks and to have those active and on board before you get cardioversion. Let's go back and think about root cause. The main problem with both ablation and cardioversion is that it often does not solve the root cause. In fact, it usually does not solve the root cause of the problem. What causes atrial fib in the first place? Well, that's part of the key question here. There are multiple root causes. This is not a simple list. Congenital heart problems, structural heart problems, valvular disease, other conditions similar to structural problems. Alcohol. We used to think that alcohol was not a problem in this area, but about 5 years ago, evidence began to show that alcohol encourages that development of atrial fib. Now, here are a couple of key ones: high blood pressure and obstructive sleep apnea. I'll tell you why those are key in just a minute, because they are what I worked on. Genetics are important. Heart inflammation, that can be due to infections and metabolic disease. If you've had a heart attack, damaged heart tissue can cause this. Now, let me go back to my situation, and by far the most common situation. You remember I mentioned high blood pressure. I mentioned sleep disordered breathing or sleep apnea. And one thing that I didn't mention that causes both of those, an extra 5 or 10 or 30 or 50 or 100 pounds. So my BMI was already low. It was 23. But I decided, you know what? I know that a little bit of weight loss, a little bit of improvement in sleep apnea and improvement in blood pressure, all of these things can help dramatically in terms of reducing the time that you're in fibrillation. I decided to go the weight loss route. Even though I was already thin, I could still lose a few more pounds, and I did. I lost 5 pounds, then 8 pounds, and bounced around between 5 and 8 pounds. My blood pressure improved. My sleep improved in terms of sleep disordered breathing. And guess what? I went from over 20% time in fibrillation down to not noticing any at all. We repeated it. It was very, very unusual for me to go into a fibrillation episode. So I went way less than 2% from over 20%. How did I do it? I lost between 5 and 8 pounds. Consider that. There's a major cause that's actually neglected every day. It is the thing that's killing more people than anything else. If you follow this channel, you probably are already guessing. It's that major cause. It's metabolic disease, insulin resistance, mostly known as prediabetes and even diabetes. This leads to cardiovascular inflammation. Inflammation leads to alterations in the atria and triggers atrial fibrillation. Now, aging is another cause, but there's a case to be made that metabolic disease is very involved in aging. And in fact, I would say, I say it all the time, growing old's not for sissies. Metabolic disease, in other words, prediabetes, 90% of which is undiagnosed, multiplies the rate at which you age. Some people actually have periodontal disease, which is a significant risk factor. Periodontal disease, fillings, mercury amalgams, all of these have been linked to atrial fib. So the bottom line is there is a connection between oral health, mouth health, tooth health, and multiple types of cardiovascular and cardiac disease. If you're in the Bale-Deneen community, you know that. You've been hearing that every time Brad and Amy talk. So if you can, work with your docs, work with your dentists, look for root causes for these problems and deal with those. Again, surgery is not the answer. Procedures are not the answer. Medications are not the answer. Lifestyle is the kink here. You cannot out-prescribe. You cannot out-procedurize. You cannot out-stent. You cannot out-ablate a lifestyle. And the most important part of lifestyle is diet. And the reality is the most important part of diet is staying a healthy weight and having good muscles and very little body fat. What about natural options, supplements? If you're working on root causes and worried about clots and you don't want to take medications, a lot of people say, well, supplements are a better option. They're not as dangerous. Let's get into that review. Nattokinase. It's an enzyme that comes from natto, a Japanese dish made of fermented soybeans. Evidence suggests that it has blood thinner benefits, and it appears to be true. It can improve arterial plaque. The evidence does not yet support that it actually decreases the risk of clots with atrial fibrillation. I'm sorry to say that, but that's the evidence. Magnesium. It's another popular supplement. It has very interesting data and evidence supporting it. It's even used in hospital settings to improve life-threatening cases of arrhythmias, including atrial fib. However, there's just not enough evidence either to support the idea that oral supplementation of magnesium can improve atrial fibrillation. So, again, sorry to tell you that, but that's the evidence at this point in time. Hawthorn plant. Okay, if you're a hawthorn fan, it's also very popular. There's some good evidence that it can decrease mortality in people with heart failure. But similar to the others, there's just not enough evidence to indicate that it will save you from atrial fibrillation. The next one, quercetin. Quercetin is a natural flavonoid. It's a compound with multiple anti-inflammatory and blood-thinning properties. Some research suggests its use for atrial fibrillation. There's no question. But it's still not definitive in terms of managing risk in humans. Cayenne pepper. Oh, cayenne pepper is very popular. It's a spice. It has similar effects to other antioxidants and anti-inflammatories. Even though I believe there is good evidence for plaque prevention and cayenne pepper, most of the evidence suggests that it's just not specific enough. It doesn't provide benefit for atrial fib. And in high doses and in bad quality supplements, cayenne can actually increase your risk. So be careful there. Now, last but not least, we have the omega-3s, the fish oils, the krill oil. They're even more popular. Recently, however, there was an article claiming that omega-3s can actually increase the risk of atrial fib. I've reviewed that article. The main takeaways are this. There is an increased risk of atrial fib, about 13%. But as you dig deeper in this article, it decreases the risk of heart attacks in people with atrial fib by 15% and the risk of death by 9%. The risk was usually seen at very high doses, 4 grams a day or more, and the vast majority of people take 2 grams per day or less. What do I do about omega-3s? I take omega-3s, even though, as I've told you, I have atrial fib, or have had atrial fib and am now at a low rate of fibrillation and am managing it. I continue to take the NOAC. I've switched from Eliquis to Xarelto, not for clinical reasons, but for payment and insurance access reasons. Let's talk about some other strategies. You'll hear and read about acupuncture, yoga, biofeedback. Still, the strength of the evidence in those is just not the best. I'm sorry to tell you, but it's not the best. So what's the takeaway here? Don't rely on a supplement or even a medication for your prevention. You know, it's just like every other type of prevention. You can't out-supplement it. You can't out-medicate a lifestyle. Look for your root cause. Change your lifestyle. Get it where you need to be. And you want to use some supplements. Okay, that's great. Just be careful about combining them with medications, making sure that, and most of all, making sure that you're not relying on those alone to get you out of a lifestyle problem. As I said before, if you have atrial fib, please, first of all, consider blood thinners. As I said, I did, and I use medications, the NOACs. I don't use aspirin. I don't use the vitamin K antagonist like warfarin. Although I use supplements, I don't use them alone. Most of all, I use lifestyle. Now you have a broader picture of atrial fib, what it is, the risks behind it, and how I even manage my own atrial fibrillation. But, as I've said before, atrial fib was not my main problem. It's usually not yours or others either. What is it? Metabolic disease, insulin resistance, prediabetes, diabetes. They are my main problem. That's what causes plaque to build up in my arteries, and that's what causes my risk. Speaking of plaque and risk, I was able to actually reverse 20 years of arterial plaque, believe it or not. Now you can see how I did it, and I think it's here.